Hi, it's Ashley again. I'm just going to conduct a neurologic exam, and then we're going to follow up after and do a musculoskeletal exam, kind of check out your joints with your movement and range of motion and things like that. Okay, so we're going to start with neurologic first. So I'm going to cover one eye. Can you see my face entirely?
Yes.
Can you see my finger?
Yes. Yes. Yes.
Does it look the same on both sides?
Yes.
How many am I holding up?
1. Oh, I looked. Wait. 2, 4, 5. 1. I can't see it. 2.
Can you see my whole face? Everything?
Uh-huh.
How many fingers am I holding up?
2. 3. 1.
Do I look the same both sides?
Mm-hmm.
Okay, perfect. All right, I'm going to have you stare right over my shoulder, kind of look at that wall, like the corner of the TV, perhaps. I'm going to shine a light directly into your eyes. Just look straight ahead, okay?
Mm-hmm.
Perfect. Good. All right, now I'm going to ask you to follow this pen. Look straight here, okay?
Mm.
Good. Okay, I'm going to move this pen towards your nose. I want you to look straight at it. Perfect. Good. So now we're going to check some sensation. I want you to close your eyes. I'm just going to use my fingers to touch you, okay? I want you to say the word yes when you feel me.
Yes. 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 Yes.
Perfect. Now we're going to do it. It's like a pain sensation. So I am going to use this pin here. It's not sharp. It's just to test a different type of sense. So I want you to close your eyes again. I want you to feel if you feel me touching.
Yes. 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 Yes.
Perfect. Okay, now I want you to open your eyes. Can you wrinkle your forehead? Can you frown? Make like a kissing face. Perfect. Close your eyes really tight. Stick your neck forward. Open your eyes. Perfect. Okay. So, can you stick out your tongue for me? I want you to move it around, side to side, up and down, all around. Perfect. Say ah. Stick your tongue out. Good. Okay. Now I'm going to have you shrug your shoulders up. I'm going to try to push down. Shrug them up. Good. Now I want you to kind of look down, push your head down towards me. You can relax your shoulders. Push your head down. Good. Now I want you to try to turn against my hand. Good. And this way as well. Perfect. Okay. So we shrugged your shoulders. Now I want you to put your hands out like this. Like just out flat. All right, I'm going to push down. Don't let me. Good. I want you to, can you stick your feet out there? You can put your hands down, relax them. I'm going to try to push down on your feet. Don't let me. Good. I'm going to try to pull up. Don't let me. Perfect. Okay, now I want you to take your finger. I want you to touch my finger and then touch your nose. Touch your nose. Yep. Okay, can you use the other hand? Finger and nose. Perfect. Now the next thing I want you to do, I want you to take your right heel, put it against your left shin, and go all the way down towards your feet. Does that make sense? Yep. There you go. And I would like you to do that on the other side as well. Now we're going to test something else. I would like you to take your hand like this, and I kind of want you to flip it like a pancake.
Do this.
Yep, back and forth. Perfect. Now do the other hand. Flip it. Perfect. So I want you to close your eyes. I'm going to put an object in your hand. I want you to tell me what it is, okay? Close your eyes. Feel around. What is that?
Pen.
Perfect. Now I'm going to take your hand. Can you give me your hand? I'm going to... Yep. I'm going to draw a number in your hand. I want you to tell me what number it is.
A 9.
Perfect. Okay. Now I'm going to use those same pins again. And I'm either going to touch you with one. Give me your hand. I'm going to either touch you with one or two of them. And I want you to tell me one or two, okay?
Mm-hmm.
Ready?
1, 2, 1, 2, 2, 2.
Perfect. So I'm going to see this one. Same thing.
1, 2, 1, 2, 2.
Perfect. All right. Keep Keep those eyes closed. Now, I'm going to touch you on both the left and right side. I want you to say if I'm just touching you on the left, just the right, or both. Okay?
Okay. Both. Left. Right. Both. Both. Left. Right.
Perfect. Okay, so now I'm going to have you stand up. You can open your eyes. I'm going to have you just kind of walk. If you can stand here. Let's go right over here.
Mhm.
Oh, can you just walk towards the bookshelf for me? Just walk normal. Perfect. Turn around, walk back towards me.
Mhm.
Just making sure your gait is even throughout. Okay, I want you to turn and walk that way, but walk on your tiptoes. Perfect. Okay, come back. When you come back, walk on your heels. Good. Okay, you can stop. All right, just take a step back that way towards the... Okay, stand with your feet together. Close your eyes. Perfect. All right, we are going to move on to the musculoskeletal system. So I guess you could take a seat back on the bed there.
Mhm.
We are going to start with your hands. So we're going to just start looking and first to make sure there's no obvious abnormalities, nodules, bumps, anything like that, any redness or any swelling. Everything appears to be normal. We're just going to palpate all of the joints all the way down. Let me know if you feel any pain or tenderness. Any pain or tenderness
No.
around any of these? We are going to feel the bones in your wrist. We're going to do the same on this side just to compare to make sure they are even, symmetrical throughout. Okay, now we're going to check some range of motion. So I'm going to take your hands, you flex them up, flex them down. Perfect. Put them flat like this. Can you go out to the side and in? I want you to open your fingers up, close them. Perfect. So I'm going to look at your hands again. I'm just going to feel, we're going to palpate for your, it's called a snuff box right here. Palpate there. Okay, I want you to make a fist, but put your thumb inside. Flex it down. There's pain in there. Any pain?
No.
Perfect. We're also going to do what we call an Allen's test. I'm going to do it on both sides. It's just to see the vasculature and the blood flow to your hand. So I want you to make a fist and open it up so your color looks normal there. I'm going to place my hands over your radial and ulnar nerves. Make a fist. Open it up. Hand should be white. Okay. Release one. See how it pinks back up?
Mhm.
We're going to, okay. Make a fist. Open it up. White. Comes back. Perfect. Do the same to this side. Make a fist. Open it up. All right. Make a fist. Open it up. Good. Okay, so now we're going to do, this is a test that kind of checks for carpal tunnel. So I'm going to have you take your hands, but put them down this way. Okay? I'm going to push them together a little bit.
Mhm.
Are you feeling any pain?
No.
Okay, release. Any pain?
No.
Perfect. Okay, we're going to move on to the elbow. Check the elbow joints here. First, we're just going to palpate, note obvious abnormalities, any bumps, swelling, lesions, anything like that. We are going to feel and the sides here. Always the same on both to compare. Okay, so now we're going to flex up with the elbows. Yep. Extend. And then we're going to pronate and supinate. So put your hands, palms up, palms down. Perfect. Now we're going to move on to the shoulder. So first, just making sure you're like symmetrical throughout. Again, no obvious bumps or lesions, anything like that.
Mhm.
I'm going to start palpating out this way. Let me know if you feel any pain or tenderness. I'm going to start on both the shoulders. Bicep. Okay. No pain or tenderness felt throughout there?
No.
Okay, so what we're going to do is you're going to flex your arms forward and back as well. Yep, perfect. Go out to the sides. And then I'm going to have you lift one arm up and like scratch the back of your neck. You put your right arm down. Perfect. And then I want you to take it behind and kind of try to scratch your opposite shoulder. Perfect. Any pain or tenderness throughout those movements? I'm going to have you do the same thing with the opposite. Good. And then right around to the back. Okay, so now we're going to start with your neck. So if you're, I'm gonna have you actually I'm gonna have you turn this way. Yeah, face that wall. So we're just gonna move your hair out of the way here. Just look for any pain. Make sure everything is aligned. We're just gonna start. Feel at C7 with this prominent bone here. Kind of work our way down. Any pain or tenderness?
No.
Perfect. So what I'm going to have you do, you can kind of face me again. Put your chin to your chest.
Mm-hmm.
Back up. Neck all the way back. Ear to shoulder, ear to shoulder. Then I'm just going to have you kind of roll your neck all the way around. Perfect. Okay, I'm going to have you just stand up for me here. I'm just going to check the rest of your spine. Just making sure we have the normal curvature and it doesn't, like you have the proper like S curve of your back there.
Okay.
So we are going to just palpate down as we did. You said you felt no tenderness throughout, all the way down. Can you lean forward for me? Flex a little bit forward. Yep. Try to touch your toes. Good. Making sure everything is aligned throughout. Perfect. I want you to stand back up. Lean back just a little bit. Try to flex backwards. Perfect. Now I'm going to have you kind of go to the side. Perfect. Into the other side. And I want you to do a little twist for me.
As I'm
Nope,
like
stand.
this?
You can stand straight back up and do a little twist. One way. Yep. That is very, very far. Pretty good.
Thank you.
Okay, I'm going to have you sit back down on the bed, and I'm actually going to have you lay down.
You want me to turn
Yes,
this way?
you can turn this way, and we're going to lay down. We're going to start with your hip here. At first, if you were complaining of any hip pain, we would have you be in a gown and like appropriately assess. But since we have no complaints of that, we're just going to go on with the exam. Just to make sure everything is even, it appears appropriate, no signs of abnormalities or anything. I'm going to feel along the hip joints, all the way around. I'm going to have you kind of lift this leg up, straight up. Any pain or tenderness?
No.
All right, we're going to go back down. Same with the left leg. Up, back down. Perfect. So I'm going to have you lift and kind of go in with it. Okay, and then come out towards me. Perfect. I would like you to do the same with the left leg. In and out. Perfect. All right, now I'm going to have you lay on your stomach really quick. We're just going to have you flex your hips up. So if you could take just this leg straight up, like back. Perfect. And the other leg as well. Good. You could sit back over. You can sit and swing your legs over to the side. So now we're going to move on to your knees. So I'm going to have you let your legs dangle if you want to scoot forward just a little bit. We're just going to take a look, make sure everything appears appropriate on both sides. Are you having any knee pain at all? No? Okay. So everything looks, okay, we're going to just palpate the back. Good. So we're going to have you extend your leg. Perfect. And we're going to have you flex it back as well. I know it's kind of hard. You can kind of pull it up and flex. Good. I'm going to do the same over here and back. Okay. Now we're going to move along to the feet and ankles. We're just going to kind of look at them both. Make sure they appear equal. Palpate. Any pain?
No.
No. Any pain? You flex your feet up, down, and then can you just roll them around? Perfect. Also, while we're here, we are going to circle back and we are going to check your deep tendon reflexes as well. So what I'm going to do for that, I'm going to have you sit with your arm like this. Perfect. We're going to check the brachial. Perfect. Into this side. Perfect. All right. And I believe that does conclude my assessment with you. Do you have any other questions or anything for me today?
No.
Thank you.
Thank you.